So the first case that I'm going to present is about rash after showering, and Dr. Raleigh already referred to that in her talk. The reason we picked this is because it's one of the most common symptoms that we've heard, at least in Pennsylvania, in relation to water. So we want to use this to demonstrate what are some of the issues with water exposure. We're talking about a family of 5. Mother, father, and 3 children who've been living in a county in Pennsylvania where there's been some natural gas activities. The children are aged 11, 14, and 18, and they've been living on this farm for more than 20 years, and they use well water as a main source of their drinking water. The mother, when she comes to you, when she's talking to you, she says that sometimes when the kids take a shower, especially when it's with hot water, the part of their body where the water hits it, they get this rash that then later on goes away. So like I said, they use their well water for drinking. They also use it for washing their dishes. Where there are in about half a mile from their house, there have been 2 wells that have been constructed in the last year. One of them was drilled and then fractured. The other one was drilled only. And they say that after the second well was drilled, they noticed this kind of oily residue on their water. When they noticed that oily residue, if they were drinking the water intermittently, they would have some abdominal cramping, some nausea. And so when they noticed these symptoms, they thought it might be related to the water. They stopped drinking it. However, they got bottled water to kind of make their food and tea and stuff, but they continued to take showers, and they were still doing things like brushing their teeth. In terms of the past medical history for the family members, the middle child has a little bit of kind of mild anemia on their blood count and a little bit of a thrombocytosis, let's say platelets, 517. And the mother has a history of Lyme disease. In most scenarios that I've at least seen this story being told, the rash has never been present at the time that there's right. Not exactly, never. So it makes it incredibly hard to tell. That's why it's sometimes important to say, take a picture. I mean, how many times have folks who have to do dermatology look at a picture and I have no idea. You still might not be able to tell from the picture what it is, but at least that's a start. The other issue that you guys have mentioned, which is really, really important, is that you still do your medical history. You still do your history and physical, of your past medical, your review of systems, like all these kind of associated symptoms that you talk about, the social history, the smoking, how long did it persist. So the environmental history is in addition to what you would do to your medical history, right? You still have to figure out, why is this kid, it's possible that mild thrombocytosis goes with the mild anemia, but you got to still, figure it out. Maybe it's, newly menstruated. I mean, who knows, but you still need to figure that out. And then the other issue that we're going to talk about, if they've had their well water tested and about timing and diagnosis, so chronology is an incredibly important topic because, of course, if the symptoms were before the wells were drilled, well, there is no correlation, is there? So, and sometimes, it's a recall bias. You notice a symptom, you notice that there was drilling, and you think that it might be related, but it's only after you've really kind of, probed into that in detail that you realize that this actually predated that. So it really can't be related. However, sometimes it's actually very much temporally related. There is a chronology. So, great. Okay. So you see the family, and essentially all family members have normal abdominal exams. And the middle child has, some kind of acne like white comedones on their chest and on their back. Essentially, this is kind of, the picture that you have, and this is, all you have at this point to evaluate this family. Somebody can come to you and say, I have these symptoms, and then you might be able to tie it to an environmental exposure. Somebody might come to you and say, this is my water. What's going to happen? So there's kind of this, difference between, you might choose to go about this in two different ways. One is that if you, for example, want to see, what are the contaminants of water, that's generally divided into, I divide it into 5 sections. One is, the bacterial contamination, which gives you mostly gastrointestinal stuff, and we talked about that. The other one is the inorganic, so heavy metals, like lead. The other one are the organics, so volatile organic compounds. Maybe that's what gives you the oily residue. I don't know. Then there's the radioactive material, which we'll talk about, that are often normally occurring. And then there's the proprietary stuff that we just don't know what they are. But then you can also come at it from, somebody says, this is my water, what should I do? And you can think, well, okay, so did you have, pre-drilling water tests? And you can evaluate whether what would be an acute exposure versus what if this was a chronic exposure? What if this was there all along for the 20 years? Or you can think of it as kind of organ system. Which organ system does this impact? So this family did do water tests, and again, like I said, these are all doctored up, so don't think you're going to recognize them. And then in this test, the thing that I wanted to just point out is that it depends on who does your test. Of course, I'm sure you know. For example, when the EPA does it, it looks different. They mention their method. When the Department of Environmental Protection does it, it looks different still. And yet, if a third company does it, again, they have their own formats. This was done by the EPA, and then they noted the maximum contaminant levels on the right side. We'll talk a little bit about maximum contaminant levels at the next slide. But if you can see that the second row, the iron is 0.317 mg per liter, and the MCL is 0.3. So that's a tiny bit above the MCL. And the important point about this is that just because you have a kind of a slightly elevated contaminant, it doesn't necessarily mean that's the smoking gun. That could be elevated for several different reasons. For example, some people in the background, they could have elevated heavy metal levels. That's just what that region is. Sometimes it's kind of the method of collection. I've heard of stories of the container that was used to collect it knocked some of the heavy metals into the sample. Or if you get it from a pipe or something, then that could also contaminate your sample. So this is a website by EPA that defines all the criteria for the contaminants that have maximum contaminant levels. This is just one page from that. It's like a whole big PDF that you can go online and look at. The secondary MCL are the ones that there's no, that EPA doesn't have enforcing ability. They can enforce maximum contaminant levels, but not necessarily the secondary maximum contaminant levels. And then in terms of the testing itself, the Environmental Health Project recommends certain things to be tested for as a kind of like a preliminary kind of a red flag to test for other things. Some of them can be done just by citizen monitoring. There are toolkits to check total dissolved solids. It's important to kind of remember where you get your samples taken. So on that water test, it will say where they were taken, the spigot, the creek, the well, and then again, how to obtain the sample is very important. Most of you are probably all very familiar with these contaminants of water well, and we mentioned a whole bunch of them. The important thing here is that some of these, while you could see them in flow back or in drilling muds or in drill cuttings or whatever, But most of these are actually naturally occurring, except that they live, so below, the subterranean level that you might not generally see it. Although again, in some regions they might be naturally occurring. But if you've got seismic testing, or if you have, if there's a well that's drilled or fractured, then this can, bring up some of these contaminants. Just a little point about endocrine disruptors. I won't go into that here. As I'm sure you know, endocrine disruptors are the compounds that affect, our hormonal axis, humans as well as, animals. And the important point about endocrine disruptors is that they don't necessarily follow the typical dose-response pattern. So if a lot gives you a certain amount of symptoms, less than that might not necessarily give you less symptoms. We just don't know what the lesser amount would do. Generally, because of the fact that it impacts the reproductive organ systems, as well as other organs, the women and children are at risk. So back to our family of 5, remember there were 3 teenagers in the household. 2 of them might be at risk, might be in the reproductive age, as well as the mother, I suppose. So they could get pregnant. So that would be possibly a vulnerable population. And when Theo Colborn, when they did that testing of the where they looked at the CAS numbers, the chemical numbers that were in the flow back in the spill that was in New Mexico, I believe, they essentially categorized 47% of the contaminants in flow back as having endocrine disrupting qualities. So this is from the National Report on Human Exposure to Environmental Chemicals. It's put out by the CDC, and essentially what it is, it's about kind of the national reference ranges. And this particular one is about urinary barium. It's here to kind of let you know that some of these, I actually really like this publication, but it's very, very detailed and kind of it's a little bit kind of hard to get through. The important part is that this is not telling us whether a lab result is normal or abnormal. It's just telling us where our lab result might be sitting in relation to the rest of the national population. So is it on the 50th percentile, 75th percentile, 95th percentile? You have to know the gender, you have to know the age, you have to know the kidney function, and you also have to be having the right test. So this is urinary barium, so of course you can't be measuring it against blood barium. Okay, so for our family, what do we say? Right, it'd be great if they had pre-drilling testing, right, to go dig it up so you can compare, because if the iron was elevated still in that pre-drilling testing, then you can compare that. We want them to monitor for these things that are some of the key components of the water. So we can talk about whether coliform bacteria should be expanded to include silt-producing bacteria in relation to hydraulic fracturing. To avoid cooking and drinking until there's a better understanding of what's happening with their water. And then in some parts of the country, like for example Bradford County, I know, if there is possibility that there might be methane in the air or in the soil or in the water, I know the PP's methane alarms, I don't know if you can buy them just kind of on the market. I don't know about that. You can use methane alarms in your basement, because while we don't know what the biological impacts of methane might be, it's definitely a hazard because fire and of explosions. So these folks can also take, if there's a suspicion of having volatile organic compounds or methane, they can take shorter showers, and have ventilation in their, while they're doing that. For healthcare professionals, it's important to remember that that testing isn't everything. So you want to test at for the appropriate things at the appropriate time, right? The heavy metals and salts are generally, urine is a much better test. It's amazing how many times the blood gets tested for certain things like barium. Some things it's okay to check blood, but for most things it's actually urine. We want to do it at the right time. So if the ingestion happened, what generally happens is that somebody might be drinking their water, then they get their GI symptoms, and a week later they're like, I think this was because of that, and then they call their doctor, and 2 weeks after that they get their appointment with the doctor, and so now you're 3 weeks out, and then it's unlikely that if you test your blood for that, you're going to find something. Urine, you might have a little bit more of kind of like a leeway with time, but still not 3 weeks. That's really maximum 2 to 3 days. And it's also important to check the right thing for the blood and for the urine. I know that again for black barium, some of the reference ranges was used. That was for serum. They were also using it for whole blood. So you can't compare whole blood with serum sometimes. And then for urine, you want to make sure that the vials that you have is the right vial, where it's like heavy metal free, etc., etc. And then we'll talk about, Dr. Wiley will talk about biomonitoring, but there's also some questions about hair analysis. I don't know if you guys come across that. So some people think, some people also recommend hair analysis. The bottom line is that hair analysis, there has not been any established reference ranges except perhaps for mercury, so it's not a recommended test at this point.